say thank you so much to the organizers for inviting me. Just listening to the previous speakers, I've just been so inspired. Thank you for sharing the screen, yes. Okay, yes, so from the introduction, my name is Dr. Cassandra Akinde, and this is my impact leadership journey. And I'm the executive director for the New Child Initiative for Africa. Okay, so next slide, please. Yeah. So what is the New Child Initiative for Africa about? Well, we are basically a non-profit organization. We're a group of young and passionate individuals who are deeply passionate about improving access to essential healthcare services and sustainable education amongst children living in the slums and underserved communities in Nigeria. And our motto is our today remains about their tomorrow. And that's because we believe that the actions that we take today determine the future of our children. Okay, please, next slide. So when I think about what made me join the TNCI, what made me join the NGO, I look at case studies like this. You see this boy, he's a 7-year-old boy. His name is Ola. It's not really his name, or his real picture. But this 7-year-old boy, he had a poke in the foot when he was playing with his friends. And when can you guys hear me?
Oh, yes, we can hear you.
Okay, thank you. Sorry, I thought it was an issue. Yeah. So this 7-year-old boy who had an injury, after he got injured, he was afraid of telling his parents. And so he told his grandmother. And his grandmother asked him to rub a herbal concussion on the foot, thinking that it's going to help him. And after several days, he developed symptoms of tetanus. So for those who don't know what tetanus is, it's a vaccine-preventable disease. And some of the symptoms are quite horrible, actually, specifically painful spasms. And unfortunately, when the child presented, the parents did not have enough money. And by the time they did bring the child to the hospital, the child died. So, please, next slide. Now, for some of us wondering, this is actually what happens a lot. This is not an isolated incident. Just like a lot, millions of Nigerian children are surviving on a tiny thread. And according to the UNICEF and World Bank reports, it has been estimated that 1 in 10 Nigerian children die from most preventable causes, and that's before the age of 5. And also, Nigerian children are 20 times more likely to die between the ages of 5 to 14 when you compare children in developed countries. And so when I remember what actually made me join TNCI, it was cases like this. This is what I was seeing on a daily basis as a medical student when I was in University of Lagos, the medical school. And these cases is when I realized that as a medical student, I shouldn't wait till I become a doctor before I can start making a change in my community. It had to start immediately for me. And so instead of complaining about the country, about the government, about the lack of resources, we decided, that's me and my team, we decided to do something about it, one community at a time. So we decided to take steps because here we are medical students, we have certain knowledge, we have certain skill sets. These are the things that we can actually go into the communities and educate caregivers, parents, children, about healthy habits that they can form And most importantly, teach them about all these preventable diseases, and most importantly, how to prevent them, starting with immunization. Please, next slide. So my journey, like I explained, began in the medical school. And once we took action, that we started volunteering. So I was medical school, my colleagues and I, we were volunteering. We weren't collecting money for these things that we were doing. We just used to go to schools, educate children how to wash their hands properly, because we knew that hand washing is the best way to prevent so many illnesses, majority of diarrheal illnesses specifically, and even pneumonia. And so that's how we started. And through volunteering, we actually, so we started from just going to the schools in the community. Then we decided to start conducting outreach, because we knew that just educating children is not going to be enough. There are so many essential healthcare services that the children in the community needed. And we decided that, okay, with our little resources, we are going to start fundraising, right? We are going to also get people that share our vision, and together we'll be able to actually intervene in some of these communities, especially the ones who are presenting on such larger basis, specifically with all these disease conditions, because it was horrible to be seeing children coming to the accident and emergency with all these preventable diseases, right? And once we started, that's when I really realized my purpose, and I really realized my talent, right? In my 4th year, that's when, since I already had some volunteering experience, that's when I knew that public health specifically was my calling, not medicine or surgery or ONG or even pediatrics, because I knew that my strength actually lied in being able to design some community initiatives that could actually impact the target beneficiaries in the community, which happens to be children and even women too. And so, okay, please go ahead. Next slide. And so we decided to start changing the narrative. And so you can see here in 2017, we started with the end tetanus vaccination drive, because that was our first main concern, to how to end tetanus, because we didn't want more children to be dying from it. And so we usually conducted an awareness campaign. So it was something small, but now, of course, it's much bigger than that. But we started with awareness campaigns, mobilizing resources for immunization specifically, and of course, partnering with the Department of the Primary Healthcare. And we also made sure that we involved a lot of other medical students and nursing students and even dental students to all join, and even medical lab students as well, because we knew that for our outreach to be successful, it's just not to fully focus on immunization, but actually look at other essential healthcare services such as nutritional assessments, malaria screening, free medical and dental checkups, deworming, provision of essential drugs, and what have you. So that's what we did. So you can see here that in 2017, this is how we were changing the narrative every year. You can put the next slide. Every year with different focus, specifically in terms of immunity, specifically in terms of vaccine preventable disease. So in 2018, you can change the slide, please. You can see that we focused on pneumonia, because pneumonia is another vaccine preventable disease that has been killing children under 5. Please, next slide. You can see here, and we made sure that at least every time we went for our health outreach, we targeted at least 500 children, and all of them were vaccinated. And of course, we also partnered with the primary healthcare center, so that in case we found any serious emergency, we always refer them to the nearest primary healthcare center. So that's for 2018. You can see the other slides as well. 2019, we also focused on WASH. Next slide, please. Yeah, and this is still currently going on. So that's water, sanitation, hygiene, education against diarrhea, undernutrition, and pneumonia, because it's important to integrate. We decided that we needed to integrate our community interventions. And yeah, you can change the slide. So yeah, here we also, this is basically what we are still doing: malnutrition, malaria screening, dental checkups is what you can see. So we started it, you know, in a small way, but thankfully with support from the community, with the support from my volunteers, with the support from our partners, with the support of our friends, you know, family, and also funders, we've really been able to impact. Okay, you can change the next slide. We're able to impact, you know, almost 20,000 children in Nigeria. But you know, all these things, they don't come without challenges, right? There are always challenges. Some of the challenges that I faced as the executive director of this NGO has been, you know, lack of funding, you know, have been lack of resources. I mean, lack of resources, not just material resources like, you know, the drugs, pharmaceuticals and things, but also in terms of material resources, community apathy. Sometimes when we went into the communities, you know, it's not all the time that the community members, you know, were very eager, because, you know, they had certain bad experiences in the past with the government, you know, and we always had to make sure that we were innovative in our approach. And of course, there's bureaucracy. You know, sometimes when we went to the communities, there used to be issues as well. You know, there are certain incentives that some LGA, some local government area chairman, you know, expected, you know, and things like that. Political instability, that is also some of the challenges that we have experienced. Please, next slide. But of course, despite these challenges, we have been able to come up with some strategic ways to actually be able to address them. So, excuse me, please, the next slide. Yeah, so for example, we realized that, you know, to be able to address the issue of lack of resources or the issue of lack of funding, right? We can't do it all by ourselves. I mean, we're a small NGO, right? And we believe that, you know, partnership is the new competition. And so we made sure that, you know, we partnered first with the community structures that exist in the communities that we are targeting from our beneficiary communities. And then, of course, with the nearest primary healthcare centers, because they are very important community structure and a partner for us. And of course, we'll also make sure that we partnered with the private sector, pharmaceutical companies, you know, because we realized that, you know, on our own, there's not, I mean, there's something we can do definitely, but with partnership, we can really get a wider reach, and most importantly, get resources and get funding at a much greater speed. And that's what has helped me to be able to actually make some impactful community interventions till date. So driving community and stakeholder engagement. We realize that, you know, when we have a community intervention, we must always involve very key stakeholders, right? The traditional leaders, the religious leaders, you know, everybody, market women leaders, the youth leaders, because in every community, there are very important stakeholders, the community members themselves, the ward chairman, because without them, the project will not be successful, and most importantly, it will not be sustainable, because it doesn't make sense for us to go into a community, you know, provide all these essential healthcare services, and then we come back again and they still have, that's health services and education, and they still have the same disease incidence of some particular diseases, you know, or some particular conditions. No, the idea is that we go there at least once or twice, and the prevalence of particular disease is reducing, because they are more aware of their environment, they are more aware of the things they need to do to prevent certain illnesses. And so that's what we like to do, and that it's sustainable. So for example, when we did our WASH project, right, we wanted to make sure that children, caregivers, you know, everybody in the school specifically knew how to wash their hands properly, right? And with that not just that they knew how to wash their hands properly, but that we established wash clubs in the schools, so that way every month the wash clubs, they will keep on excuse me, they will keep on encouraging. If even if you had forgotten, or maybe you are lazy, you don't want to wash your hands after playing with your friends, you remember that no, you can't, you must continue washing your hands all the time, because the teachers are watching you, your peers are pressuring you to wash your hands always, and that way, and the fact that there are wash clubs there, it's more or less sustainable. And so that's what we wanted to ensure. So developing community-led programs. Also, we realized that, whenever we make interventions, they have to be integrated specifically with the beneficiary community needs. For example, we had an outreach for Stop Pneumonia. I realized that it's not just pneumonia that was an issue for them. WASH was also another area, specifically in terms of lack of clean water. They didn't have any water, like a borehole or something, right? That actually gave them a sustainable supply of water. So we had to partner with another NGO, which Water Is, that is actually, what they actually do is to provide clean water. And so with that, we were able to make sure that, this community, not only do they have access to water, but they also have now access to wash education, and they also have the Stop Pneumonia campaign going on in that community. So research and impact evaluation, realize that, everything we do must be data-driven. We can't just keep going to the communities and not come back with data. And so that's why we decided to make sure that every time we have our community interventions, community outreaches, health campaigns, we actually have to document everything and make sure that we have a research going on, or most importantly, dissemination of our results, so that we can, in our little way, start advocating, and most importantly, influence policy, And every project that we did, we needed to make sure that we are evaluating our impact, both qualitatively and quantitatively. And of course, like I said, we need to be able to communicate this impact. It's not just enough to have it. We must make sure that we disseminate it with the right stakeholders. Yeah, next slide, please. So this is our impact so far. We have had 15 successful outreaches and campaigns in the past, say, 5 years. I'm talking about from my end, since I became the executive director. So we have had also 20 beneficiary communities that we have reached out. That was in Lagos, Ogun State, and so that's like 3 states in southwestern Nigeria. So far, we've also reached out to 20,000 children with essential healthcare services, that's talking about the nutritional assessments, malaria screening, immunization, and all. And most importantly, we've been able to generate almost $50,000 worth of grants, which has helped us with our project so far. Next slide, please. So these are just some of the names of some of the research publications that we have had. Some are still ongoing, we've not yet finished. So we're hoping to present some of them soon and add more to our archives. So next slide, please. So in conclusion, my journey as a leader is mostly focused on investing in future change makers by improving their health outcomes. And I believe that this cannot be overemphasized, especially in countries like Nigeria. And of course, it requires a deep-rooted advocacy, innovation, and most importantly, data-driven research in order to bridge this gap. And so this journey may be long, but each day that we take the step forward, into making sure that we are investing our today in their tomorrow. So thank you very much.